Well, hello, friends. This is Dr. Jerry with the Simple 7 Lifestyle Podcast. Welcome to episode 27. We've got some great information in store for you today. Now, I don't know if you've been keeping track at home, but over the last 10 episodes of the podcast, I've been focusing on the function of our brains a lot. In fact, including today's episode, 5 of the last 10 episodes have been about brain health, building a better brain, and, really diving into this area of brain function and mental health. And anyway, I hope it's been rewarding for you. On a personal note, my aunt was just diagnosed with vascular and Alzheimer's dementia. This is something that affects every single one of us and the people in our family that we love. So if it's not affecting you personally, it's definitely on its way. Like, we all have to deal with improving our brain health. So I hope that today's discussion will be very fruitful for you. I've got somebody on the podcast with me that I have been looking forward to interviewing for quite a long time. A really, really good friend of mine. We've been colleagues for 25 years now in practice, Dr. Jason Smith. So welcome to the podcast, Dr. Smith.
Thank you for having me on, Dr. Duggar.
Yeah, we go back a long ways. In fact, we were just reminiscing the other day that we really started our practices within a couple of months of each other in the same town. And so we've been hanging out in practice and on the golf course and on the ski slopes and with our families
And the mountain
for a
bike.
long time. And
The
mountain
mountain bike
bikes.
trails.
Yes, yes. And so anyway, I'm really excited for my audience to learn from you. If you're watching on video and you see all those books behind the shelf, that's pretty typical. You see a lot of people on podcasts with big bookshelves of books behind them, but they haven't read any of those books. Dr. Smith is probably the only person who's actually read all the books on his shelf.
I
don't know if
love to
that's true.
read. I love to learn.
Yeah, so brilliant mind, and I'm looking forward to kind of diving in. So Jason, let's just go Jason and Jerry, because I don't want to call you Dr. Smith for the rest of the interview.
That's great.
So let's start off by just giving everybody a little bit of a background on what got you into brain injury research and recovery, and really, why you're a noted expert in this field and why people fly from all around the country and around the world to work with you.
Well, back in 2008, I had a patient who was suffering from dizziness, and I literally didn't know what to do to help this person. I knew there was a way to find out the information. I just hadn't done the training yet. So I pretty much the first 10 years of my practice, I was just seeing, neck and back and headache and jaw patients, just like a lot of chiropractors do.
Right.
But I had this case who was a really close patient of mine, and I just said, I've got to find a way to help her. And so I went and did some vestibular rehabilitation training, and I did 175 hours of online and training out in Atlanta, Georgia on vestibular rehab. And that's what got me started. Once I did that 175 hours, I realized that a lot of people with dizziness also have very similar symptoms to concussion victims, and the same thing with neuropathy. And so I started going in this little triad. I'd learn one thing about balance, and I'd learn more about concussion. Then I started learning more about neuropathy. And I realized that those three things all overlap quite a bit. And
So wait a second. So
way.
you had one patient and you wanted to help her. And so instead of jumping on Google and reading a one-page article about it, you took a 175-hour certification program on vestibular rehab. Good for you. Everybody, you want a doctor like this, right? This is what you anyway, that's pretty impressive. And I've been kind of right next to you, not taking the exact same courses, but looking more at the brain and the whole body from a nutritional and lifestyle perspective. And it's been fun to kind of watch our careers and our paths overlap, as you just said, because, really the whole body is just one, complex system of overlapping organs and systems. So I want to really plumb the depths as much as we can today on brain trauma and concussion, because in episode 18, we talked about 7 main drivers of brain dysfunction. And one of those was trauma, both psycho-emotional trauma, but also physical trauma. And so what are you seeing kind of in the landscape over the last decade or so that you've been researching this? What's been going on with our awareness and our understanding of brain trauma and concussion? And maybe we don't want to use those terms completely synonymously. If you want to tease those apart, you can. But what's been going on in that arena?
Well, the first thing that we've noticed, if you read almost any paper, which there's literally 10,000 papers coming out a year on traumatic brain injury, especially even just concussion. So concussion is, in my mind, equivalent to mild traumatic brain injury. And the term, I really don't like the term mild. And
Yeah, I
that's
was
one
like,
we can
it's an
talk about
important.
in future myths discussion, but mild is it just sound I'd rather have something like grade 1 brain injury, grade 2, and the more severe injuries, the moderate and severe injuries are life-threatening, and they usually have MRI and CT findings, whereas the mild traumatic brain injury, by definition, has no MRI or CT finding. It looks normal. They tell you when you show up at the emergency room after having some kind of head impact and symptoms, then they tell you, no, your MRI looks good. You just had a concussion. They say
Yes,
that
just a
four-letter word,
concussion.
which I do not allow any of my patients to ever say again once we teach them properly.
Right.
So they, the awareness is improving, is increasing, but 2 million to 10 million treated concussions in the emergency room departments of the United States. So
So
I
if
think
that's how many are
even
being
more.
seen, yeah, what's the real impact? Oh,
It is so many. There's literally, in the last 20 years, there's probably 800 million concussions. It's so many. There's just so many brain injuries happening in this country, and I think the awareness is improving. Um,
sure. I think that the NFL, is responsible for a lot of that awareness increasing, wouldn't you say? Just the amount of attention
Definitely.
that's been placed on it from the sporting world.
And when you have a Will Smith who's acting as, I think his name's Omalu Bennett.
Yeah, yeah,
Anyway,
sounds right.
the researcher that pretty much discovered under extreme duress, discovered CTE, the chronic traumatic encephalopathy, and realizing that even not just NFL players, there's also college players, high school players, and even Pop Warner
Yeah.
football kids that are showing signs of brain injury. It's pretty
Once that
impactful.
kinda cat was out of the bag, then it's like everybody started looking for it. Now we're seeing it's youth soccer, like, it doesn't have to be an offensive lineman or a running back on the NFL level that's creating these sort of traumas. So,
Right.
yeah, I think the awareness has definitely gone up. I remember when I was a kid, I never put a helmet on when I rode my bike. So we'll talk a little bit about helmets maybe and how helpful they are. Anyway, I think there's a lot we can discuss there. So maybe tell us a little bit about the history of treatment of these things, because if it wasn't really understood what was happening after an injury to the brain, did most people just kind of ignore it and assume things would get better? What was the standard of care in the past?
The standard of care over the past 20 years has almost not changed
Whoa.
unless you're a progressive researcher, clinician who's really studied the current research. There's a lot of research in the past 3 to 5 years that's pretty much turning all the old standard treatment on its head. And the treatment was very simple. You just had a concussion. You just need to rest for a
Right.
couple, usually, till the symptoms go away. Rest till the symptoms go away. So sometimes when you look at the amount of people who recover, a lot of symptoms do go away in 7 to 10 days. So
Mhm.
it works out well for the high school football team because they get injured on Friday and then
And they're ready to play by next
rest, and
Friday?
they can't go to school or practice, but they're ready to play by next Friday. And most of the medical treatment recommendations are just rest. And that's really pretty much being proven that that's not the most effective way to treat concussion. Although I'm not against rest, I'm more for rest for 1 to 2 days. And even if you have symptoms, you need to get back to life at some level, because life, it actually helps you heal from concussion.
So there's there's some sort of a treatment curve here where too much and too little is is problematic. We've got to tease out the best balance in the middle here of the right amount of stimulation, not too much, but definitely not doing anything. I
Yeah.
think it's interesting, Jason, if we think back even to when we started our chiropractic practices, I remember being taught, most of the time after injury, the medical model was immobilization. Like we just, if you sprained an ankle, you would wrap it and ice it and elevate it and not move it at all. And, we were being taught as soon as you can introduce safe motion into that joint, you need to restore that motion and get it moving because that would actually facilitate a better healing and quicker rehab. Anyway,
Exactly.
so it's almost the same kind of paradigm shift, whereas, the old school was don't do anything and rest and the body will heal well. And you're saying, no, we actually need stimulation. We need movement, if you will, and activity in order for the brain to kind of return to its normal function.
Yeah, and definitely, I mean, I just think I know it's a little off topic here, but one of the best ways you can guarantee that you'll never recover from a whiplash is to put a neck brace, one of those rigid collars
Yeah,
on your neck right
right.
after, and unless it's
Right.
fracture,
There's times when that needs to happen, but
there is
this is
appropriate
not.
time. But if you put that on for 2 to 4 weeks after a neck injury, you can almost guarantee chronic neck pain for life, and that was an old treatment
Right.
modality.
That's funny. I don't even know the last time I've seen anybody in a neck
So rare.
brace. It just doesn't
Rare.
happen, but that was standard of care. So, but I'm interested. I'm kind of fascinated that really a lot hasn't changed in the mainstream in the world of concussion. Huh. Well, let's fix that. We're going to educate people today on some of the things that should be done, and maybe let's just kind of talk about some of those myths because I think people have some, they've got some confusion about that. And so let's dive in and talk about a few areas that we need to, correct some thinking on.
Definitely.
What would be like the number one myth you think people have about concussion and brain injury that are holding them back?
Well, almost every time I'm interviewing a patient, I'm trying to find out. Sometimes people don't even know they've had a concussion. So there's the cases where they went to the ER after, say, hitting their head on the soccer field or even a whiplash injury or a fall or something. And they know they felt weird. They might have forgotten a few minutes or maybe they lost consciousness. The biggest myth is that they need to hit their head to have a concussion.
Hmm,
And remember, concussion in my mind is equivalent to mild traumatic brain injury. They're both traumatic brain injuries. So if
right.
they think, well, I didn't hit my head, they think they're fine. And there's no way they could have had a brain injury, which the solution is, well, you can have an impact or an inertial injury where there's a shift, like a bowl of water suddenly sloshing on the countertop. If you move it quickly, there's fluids inside the brain and around the brain that shift and cause some damage.
So walk me through that just a little bit. Walk our audience through how, let's take a whiplash injury in a car accident or, being hit from the side playing a sport or something where you're unaware that it's coming and your head kind of whips back and forth, but it doesn't hit anything. So what's the mechanism that causes the brain to be injured in that scenario?
That's what we call an inertial injury. And that basically means, inside the skull, there's ridges and grooves and things. And there's cranial nerves that come out of the brain at different points, control our face and our eyes and our smell and our tongue and so forth. And those are sort of tethering the brain. But when the brain suddenly moves, there's almost always a rotation and a linear acceleration. And so those accelerations, what they call G's,
Mhm.
is what causes brain injury. And it's pretty surprising when you look at the research. You look at, well, how many G's does it take? How many forces of gravity,
Mhm.
multiples of gravity does it take to injure the brain? And they're coming up with linear accelerations around 70 to 100 Gs to literally just injure the brain. So we can take a lot of acceleration,
Mhm.
but When you compare that to injury in the neck, it only takes 4.5 Gs to injure the neck in any type of acceleration, impact or otherwise. So if you pretty much get a brain injury, you are almost guaranteed to get a neck injury. And that's, sorry, I'm
No, that's
exposing
perfect.
one of my future myths is that, yeah, if you have a brain injury, you need to check the neck. It's so critical because the neck is almost certainly injured. Remember, it only takes 4.5 Gs. It's like a threshold for injury to get injured. And so a lot of the big symptoms like headache and dizziness and nausea and fatigue can all be related to neck injury as well.
The neck component.
Yeah.
So, I mean, maybe we don't talk in absolutes, but the concept here would be that if you've had a traumatic brain injury, you've likely had a neck injury as well. But not every neck injury is a traumatic brain injury.
Exactly.
Yeah. Okay, so you don't have to have hit your head. I've seen pictures of kind of whiplash injuries where it kind of looks like the brain's sloshing forward and hitting the inside of the skull and kind of causing almost like a bruise on the brain from the inside of the skull. So just because the skull didn't hit anything, the brain hit the skull from the inside. Is that
Potentially.
a safe idea?
Yeah, they're thinking that may be even a model that doesn't quite make as much sense for concussion now. Like
Okay.
the 2022 studies that I'm reading are showing that it's more of a global depolarization and a stretch through a whole bunch of different neurons that literally empties all the energy out of those neurons. And that's why you get those symptoms. And so it's not necessarily the coup contra coup model of a hit on the forehead that then rebounds back and hits the back of the head. There's this, I mean, it's potential. That could still happen. But I think though, if you're actually bruising the tissue that you could see on an MRI or even in a post-surgery, you're now in the moderate or severe traumatic brain injury model. So we're talking no advanced imaging findings. It's probably not going to be that kind of a mechanism.
Interesting. So we're kind of getting the shearing or the stretching or the kind of pulling as the brain kind of changes its shape due to all these forces, and that's creating the damage to those neurons. Now, we talked a little bit in a previous episode about microglia and cells in the kind of the immune system cells in the brain that kind of control inflammation and repair. And many, if they're in their kind of normal, happy, quiescent state, they're just pruning and kind of managing and keeping the brain healthy and repairing little stuff. But once they get aggravated or irritated, they shift and they become pro-inflammatory and they perpetuate kind of this inflammatory cycle. And if I'm understanding correctly, as these neurons get damaged from traumatic brain injury, they kind of spill some of their, chemistry out, so to speak, that triggers these microglia. And now, obviously, they've got a big job to try to repair, but they can perpetuate inflammation if we don't calm them down.
Yeah, exactly. And, microglia can go down one of two pathways. They can be pro-inflammatory.
Yeah.
They can be anti-inflammatory.
Right.
And once they sort of morph, it's called priming. They pretty much are locked into that. And that's the scary thing about brain inflammation and brain injury is that once those glial cells, which is really about 90% of the cells in the brain, whereas only 10% are neurons, where almost all the neurology focus is studying those neurons.
Right.
So we're literally studying the smaller key player. It's a key player, but it's the smaller amount in terms of volume and capacity and quantity.
Yeah, so maybe we'll talk about this at the end. Let's talk about ways that we can try to quiet down that the excitatory, that pro-inflammatory state in the brain after an injury. Okay, so we don't have to hit our head in order to have a brain injury or concussion. So we got that. Now, that I think goes right into my question about helmets. Because we've just said you don't even have to hit your head. So a helmet's not going to protect every type of concussion.
Yeah, when patients talk to me, they're telling me the story. There's so many different ways to injure your brain. Not even just traumatically, but through chemicals. And
Right.
I mean, there's just carbon monoxide poisoning and drownings and all sorts of things, recovery from drownings and all that. But speaking specifically of helmets, helmets are not designed to prevent concussion or mild traumatic brain injury. They're designed to prevent skull fractures, which they do a very good job. So even if you didn't hit your head, or you hit your head but you had a helmet, it still is not going to necessarily protect your brain from concussion.
So my brain is kind of going back and forth with this whiplash idea now, because we know that seatbelts save lives, but they actually cause whiplash. I mean, the mechanism of the seatbelt almost ensures that you're going to have a whiplash injury to your neck, because everything else is fixed relative and your head isn't. So they save you from flying out the window and dying, but they also increase the risk of whiplash. So a helmet will protect you from skull fracture and maybe moderate and severe brain injury, but they don't necessarily solve mild, well, we'll just call it traumatic brain injury.
Exactly.
Grade
Mild
1.
traumatic.
We're going to rename these.
Exactly.
Let's just do it right now.
Exactly. There was a paper that came out that said, I think it was 2008 or 9. It said, concussion is confusing us all. We need to stop using the term concussion. But it's just in the vernacular and people are just used to it. It's probably there to stay, but we just need to clarify and have better definitions about what concussion actually is, which I should define for the listeners. Concussion or mild traumatic brain injury is defined as having a history of some kind of impact or inertial event, which then causes an altered brain function. Not necessarily, and this is one of the big myths, is, I didn't lose consciousness, so I couldn't have had a concussion.
Right.
No, that is one of those myths that just doesn't hold water, and it's just not true. You can literally not lose consciousness. In fact, only about 10 to 20% of concussions lose consciousness. The other 80%, the majority, don't lose consciousness. So that's why many of the diagnoses are not made correctly, or maybe the history isn't given properly. And most medical providers now, I think, know that you don't have to have a loss of consciousness for brain injury, but I don't think most patients and most lay people do.
Yeah, and I think sometimes the more mild the injury, the slower the onset of some of the symptoms. And so there's a lack of, connecting the dots between the mild injury and the depression that comes on, a week or two later. Has that been your experience too?
Yeah, it literally takes, once a injury happens to the brain, there's a steady decline for about 7 to 10 days of energetics in the brain. The mitochondria and the ATP, they're literally not having ideal function. And so that is a downward slope. And so you can literally have, if you have immediate symptoms, yes, you pretty much know. But
Right,
it's
those
those
are
delayed
obvious.
symptoms where it's now 7, 10, 14 days, and all of a sudden the brain's trying to regenerate those energy stores. It's trying to build that again. And it's usually a 30 to 180-day process to fully rebuild, depending on the age and the severity of that mild traumatic brain injury, get the energetics back. And it's at that point when you're just starting to improve, where maybe the symptoms have gone down some, but your energetics aren't normal yet. If there's a second impact at that point, it becomes very dangerous, because once you get even lower energetic stores, then you actually have neuron death, and it's becoming more serious, which that's the second impact syndrome. And there's cases in the media that you hear about occasionally about high school students who didn't even realize they had a concussion, and coaches who didn't know that either, and then they have another injury, and that it can literally cause death. So that's why it is important to rest, not put yourself at future risk. But this is, to me, it's critical for high school sports related concussions, but also for any adult who might be doing anything that might put their brain at risk.
I'm just thinking of a patient, elderly gentleman who was doing quite well. He would always, come see me on a regular basis, and, he had the typical kind of arthritic, challenges and pain, but he was always bright and funny. He always would tell me a joke every time he came to see me, and we just had a great time until he lost his balance in the bathroom, slipped backwards and hit his head against the wall and against the bathtub. And even with good chiropractic care and all the things that we're trying to do, his brain started to decline. I could see it. It was sad to watch. And then he was diagnosed recently with, some dementia, and we're heading down that pathway. So it's interesting that, well, let me go back. How do we fix this? Like, what do we want to do if we've had a traumatic brain injury, and maybe we've been to the ER, maybe they've checked us out and they've sent us home, or what have you, and we can't trust the school nurse to know what to do, and we certainly can't trust the soccer coach to know what to do. What should we be thinking about at home? And I guess I'm really interested in what we can do to drive the energetics back in the brain. How do we, minimize the damage to mitochondria and, improve those cells' ability to kind of repair and get back in function?
Well, I think the first thing is literally just admitting that you've had an injury to your brain. It is a brain injury. Even if your medical doctor told you it was a concussion, it is a brain injury. So if you could admit that to yourself, I mean, your brain is the most important organ that controls everything. And it's most of what our brain does for us is inhibit stimuli that come in. So you get light stimulus from going outside, or the fluorescent lights in a room, or sound stimulus from a door slamming. When you're in a brain injury, a lot of common symptoms are you're not tolerating normal life input. And so your brain's not able to suppress it, so it overwhelms you and literally further drains your energetics. So, I mean, yes, you do need to rest and avoid overstimulating certain things, but still do a little of those things. So maybe a day or two later, yeah, you go outside and go on a walk. Maybe you only go on a few 100-yard walk, but then you come back and say your headache was a 4 or 5 out of 10, you still should go on a walk. But if it pushes it, you go on I'm not saying go on a 3-mile hike up the mountain, because if you do that, then you're really going to drain your energetics, and now your headache's going to be 8 or 9. If it goes more than 2, 3, or 4 points from where it is, then you've done too much. So I think the key is just realizing, do things, be active, enjoy things. But I mean, and that's the other big treatment, is just avoid screens. No TV, no phones, no computers. That's not even really been shown to be even that effective. Now, to me, I think avoiding social media would be better because of all the vertical scrolling that happens with the eye movements. And that drives a certain part of the brain, which creates anxiety and stress. So I would recommend minimal to no vertical scrolling for the first week or 2 or 3, or even 4 after a brain injury. But to me, when patients call me, this happens literally 2 out of 4 weekends, almost every weekend. Patients will text me or call me or email me. My friend's sister's brother was skiing and had a concussion. What should we do? I'm like, well, what's the history? I mean, I can't go into, you need to have more details. You need to have a history and a proper examination. But I just tell them, first thing, go online, download the ACE form. It's an acute concussion evaluation form. And you pretty much write down the details. How did the concussion happen? Was there loss of consciousness? And then it'll go through 4 main key areas, which is, I'm doing them out of order just because I like to remember them this way. And it's the acronym SPEC.
Okay.
Sleep, physical, emotional, and cognitive symptoms, SPEC. So this questionnaire pretty much goes through, anywhere from 4 to 10 or 12 questions in each of those categories. Yes or no, do you have this symptom? Emotional would be, are you irritable? Are you angry? Are you
Anxious or depressed?
depressed? And those sometimes do come later, but Sleep. Are you sleeping too much? Are you sleeping too little? Are you sleeping a normal amount but waking up non-restored?
Mm,
Cognitive. Do you feel slow? Do you feel brain fog? Do you feel problems with memory? And then physical. Do you have headaches? Do you have dizziness? Do you have light or sound sensitivity? And a few others like that. So
mhm.
just go check yes or no on each of those things. And then just look at it. Look, I have, and the trajectory of concussion, the profile is different in every person. I've seen, I don't know, I haven't ever counted. It's definitely more than 150 concussion patients every single year. And I've never seen one that's like the other one. So
Right.
the four profiles that this ACE form helps you figure out is what are the main brain regions that control those functions. So once you
Okay.
do that, then you have a baseline, and then you can sort of track those symptoms over time. But it also makes you think of the neurodevelopmental history. Have you had multiple concussions in the past? Do you have a history of learning disorders or other brain issues that might ADD and
Mhm.
ADHD that can potentially there's the jury's still out. Does concussion cause ADD and ADHD, or does ADD people tend to get more risky behaviors that create concussions?
Yeah.
It's
I mean,
some of
back to this idea of microglial activation. I mean, sometimes m the you're not always in perfect brain health before you get concussed.
everything.
Like, we've got a lifestyle, a diet, our entire environment that is trying to kind of pushing us into a pro-inflammatory state. Got gut dysfunction and all of these things that are creating low-level brain inflammation just as we're walking around doing our
Yeah.
everyday activity. So now we get brain injury and we're compounding that. So yeah, it's rare that you're going to see somebody with a perfect specimen brain prior to a concussion. You're dealing with a situation that's already in trouble sometimes.
Yeah, so I really like that ACE form. It helps put you at ease. If you're wondered if your child did have a concussion, just fill it out. And then you're like, oh, well, there's only maybe one or two mild things. Just watch it and probably, they're going to be fine if it's very, very mild. The more symptom burden people have after this kind of event, the more likely that they're have that concussion. To me, diagnosing the concussion is not the difficult part. It's pretty much you had an impact, you had some symptoms, boom, we just call it. We say it's a concussion, we treat it that way. And we say, all right, you can roll the dice and go back to you can do whatever you want, but I just recommend you follow this 10-step procedure to return to life so that everything's at
Mhm.
its best opportunity and optimized for healing. That's what I think.
So share with us just a few of the things that you might think about in that 10-step process. I mean, you don't have to go through every single part of it, but, what would be some early benchmarks that people would want to kind of move through?
Well, probably some of the coolest research I've seen talks about it used to be sort of return to school or learning for this is for the for the youth and college
Right.
especially, but
Uh-huh.
was you had to completely return to full-time school and full-time cognitive function before you could start your physical rehabilitation. But I think
Okay.
you can sort of do those side by side.
Mhm.
And it's pretty much just being aware of what is overstimulating for you. I think, it's all graded. First start with half a day of go for a few days with no school and no homework and no testing. And then you start to say, okay, well now can you feeling better? Maybe it doesn't mean you have to have no symptom whatsoever, but now you go to a half a day of school. And it's not, "Oh, I felt pretty good today." No, go to a half a day and then go home, and then make sure that everything's good for the next 24 hours.
Right.
And then do that for a few days, go to a full day of school. Can you handle it? Okay, now you could handle the full day of school with all the environments, with the teachers, with the focus, with all the things. Maybe you're not completely taking notes and looking near and far all the time because those are known to trigger symptoms
Mhm.
in certain people.
So even within that activity, you can figure out, well, I do great with everything but bright light. So you can find the you can tease out the challenge in that environment, and then you can mitigate that with something.
Yes.
Might wear
Yes.
sunglasses or, earplugs or something to if
Yes.
there's one specific stimuli that's a little bit too much, but the other ones are doing well, then you could have a more nuanced approach as you're moving through it.
Yeah, and then right alongside that, then you're trying to return to physical activity because physical exertion changes blood flow dynamics to the brain. And so you do want to have that. I mean, exercise is one of the most it's funny, I read a study that said the people who recovered the best in this specific study were those who ignored the advice of their doctors to rest. And so you're creating brain-derived neurotrophic factors to help stimulate, neurotransmitters and everything, and so you're actually making your brain have a better chance to recover. You just
And
have to do it within reason
yeah,
and
right.
watch the next 24 hours. Don't just ramp through these 5 or 10 steps in a couple days. You need a time to make sure that everything is working still.
That makes a lot of sense. I mean, when you start talking about the aging brain and dementia and Alzheimer's, as is like the only thing that's been proven to do much help with those folks, right? Because now it might get into a little bit more physiology here, but even our muscles are producing chemicals called cytokines, and many of those are anti-inflammatory. So just as you're exercising and moving your body, you're creating the right chemistry to put the brain into an anti-inflammatory state and to drive up the energetics in the brain. You're getting better blood flow to these areas. And yeah, so doesn't mean to go back to your CrossFit or go run a Spartan race
Exactly.
until you've worked, up through that in a very kind of systematic way, right?
Yeah, and then some people are more sensitive, like maybe your sport of choice involves running. Well, you might not be able to tolerate that impact because of the brain and the neck, but maybe swimming or cycling of some sort or recumbent bicycle, that can be huge. You can get your heart rate up and, just sort of pay attention when your heart rate is up to a certain level. And of course, you need to monitor this if you want to be scientific and really know what's going on. So
Yeah.
I would recommend a good quality heart rate monitor and then see what that heart rate's at when you tend to have symptoms, and then just back off and work at that heart rate, just that sub-symptom heart rate, and you'll be able to train literally that at that level for a week, and then all of a sudden you're creating all that beautiful chemistry which helps heal your brain.
So that's great for the athlete. What about, Mrs. Smith? What about Mary who, had a slip and fall and now she's trying to do her work as an accountant and her brain's not working very well. She can't focus. She's got a headache. I mean, should she just be basically popping ibuprofen and pushing through? Or, what are things that maybe a non-athlete can think about to, to do?
Yeah, it all depends on the symptom they're having, but probably the most common symptom is headache. So it's headache, insomnia is up there. You need to be sleeping a good 7.5 hours a night. And if you can't, then you probably need some help figuring things out. But, we've had tremendous success with hyperbaric oxygen therapy in our office. We've had
Oh yeah, I wanted to ask you about that. So
hopefully,
what's going on with that? And why would somebody want to sit inside of a hyperbaric oxygen tent and what's that doing to the brain?
well, basically with hyperbaric, you're putting the brain, all the cells in the body under pressure, and you're bypassing the capillary beds and the blood flow system. We're taking whatever oxygen's in the surrounding extracellular tissue and just pushing it into the cell. So it's sort of it's good. People can sometimes, if you do it soon enough, you can notice huge changes in the acute case in just a few sessions. Some of the longer chronic cases, it might take 30, 40, 80 sessions to get
Mm.
a maximum result. But a lot of times with 5 or 10 sessions in the acute case, people can notice a huge change. So it's just getting oxygen to the cells so they can heal.
So yeah, we think about oxygenation, stimulation, and nutrition
Right.
really that are
Which
key
is
for every one of our
anti-inflammation.
cells. Yes.
Yeah,
Yeah.
so
So that's a way to just push oxygenation into those tissues. Okay, cool. So yeah, you have all sorts of tools at your disposal in your clinic that most chiropractic physicians don't have, hyperbaric being one of them. What are some of the other fun things that you do specifically that once people are kind of addressing what they can at home, and they realize, hey, I need to be seen by somebody, why would they come to somebody who's a functional neurologist or a functional neuroscience expert like you?
Well, I think there's subtle changes that happen with eye movements that and the balance system, which really need to be addressed as soon as possible. And they're so simple. I mean, there's three basic eye movements: the fixation movements, the quick movements, and the smooth flowing movements of the eyes. And people don't realize one of the reasons they can't focus is their learning system, their learning memory is off, sometimes weeks and months after a brain injury, is because their eyes are not focusing and not even tracking
Mm.
right. So it's good to use some oculomotor testing to see in a graph format what's going on and what are the subtle, gentle brain and eye movement exercises you can do to get those back on track. So we use a vestibular nystagmography headset,
Would
which
you
is
spell that for the audience? No, I'm just kidding.
exactly. It's basically looking at how the eyes move. So I'm not looking at your vision per se, like are you 20/20? That's for the
Eye
eye
doctor.
movement eye doctor to work on. But I like to say, look, how is the eyes and the neck coordinating and moving together so that you can suppress dizziness and literally appropriately get the information to your brain that you need to get.
Yeah, so
So
if you've
that's a
got bad data coming into your brain, it can't coordinate movement properly, and that's gonna lead to a whole host of symptoms, right?
especially on the cognitive side, but also on the sleep side and the anxiety and mood disorder side. Because if your eyes are shifting, 1 millimeter constantly at, 10 to 20 times every 5 seconds, you're going to feel anxious. And
Mm,
so that's more of a brain based anxiety, which
mhm,
isn't, you need to fear for your life. But if you're
right,
also perceiving this movement in your eyes when you go to sleep, even if you do fall asleep, your brain is going to be like, well, we're moving. We're not safe. We need to not,
right,
we need to wake you up. And so
right.
that's something that can help from the mood side, the anxiety and, poor sleep side, and also just simply learning. Like if
Mhm.
you're looking at a page and your eyes are moving, your literally brain is deleting what it sees every time it moves. So you won't get that information into your brain.
Fascinating. Eye movement and the connection between, just how this input affects everything going on in the brain. I think it's fascinating. And the exercises you have people do are really simple, and you're like, "What is this doing?" But it makes a big difference, so,
It does.
yeah. Okay, so you look at eye movement and balance, coordination, and then you're able to derive very, very specific exercises to stimulate and support the exact regions of the brain that are struggling. So it's
Yeah.
not necessarily this global, everybody does this,
No.
where you're able to get really detailed in and figure out, okay, well, you need to do this with your left hand and your right foot and turn
Uh-huh.
counterclockwise while you do it. Some really weird, funky exercises, but they're powerful in getting to very specific parts of the brain.
Yeah, I had this patient the other day that just had severe nausea. That was one of her main complaints. And I just sort of when hear the story of the symptom, I sort of go to the brain region that could be causing it. But she had so much nausea, and I literally just looked in her throat, and I had her say "ah," and one side lifted up, and the other side didn't. I was like,
Mm,
okay, well that maybe is a weak on that lower side. And then I stuck a tongue depressor on her back of her tongue and tried to make her gag, and she didn't do anything. And I was
lost your
like,
gag
so
reflex. Okay.
so she literally lost the gag reflex, wasn't elevating. She also, when I asked her more, she's like, "Yeah, I have had some trouble swallowing things." And so I started stimulating the gargling and making her gag herself a few times when she brushed her teeth every morning and night. And within a day or two, the nausea is 90% better. I have her check a week or two later, and now her gag response is there. And it's like, how it's this is the nerves that control the vital functions, our
Right.
brainstem, like our heart rate and our
Yeah.
gag to protect us. And if those reflexes aren't working after a brain injury, then you need to get them working so you can heal all the other complex things like how to think and
Right.
anticipate where the ball's moving and how to remember and read and all that stuff. But if you don't have that baseline, to me, that's one of the biggest secrets is I just find those reflexes and get them working again. So you can just check that. A blink one was another one. Someone sticks a tissue on your colored part of your eye, you should blink and tear up and pull away, even if you're trying to be a good patient. But people lose their blink responses all the time, and they wonder why they have fatigue and they can't focus. And so I like, that's really fun to find these reflexes. So I don't say everyone should stimulate their blink reflex. Everyone should stimulate their gag reflex. I don't do it in a blanket. It's like for case by case basis.
Yeah. Very cool. That poor woman probably would have been taking, she would have gone to the gastro doctor or been put on some medication for her digestive system. It must be your gallbladder, whatever. And would have been chasing that for a long, long time if she didn't recognize it. You got to go upstream in order to get to the cause of that issue. So anyway, very cool. Well, I can attest to the fact that your approach works. I've sent many of my patients to see you, and it's been fun to work together with you. I know you've sent some of your patients down to work with me, and I wish we could do it all, don't you? I mean, I just want to know everything.
Yes.
That's why all of our weekends are filled with seminars and online trainings, right? But we all want to know everything, but we can't know everything. So it's good to know specialists and people who really have a passion and an expertise in an area. And, my audience, I know will benefit from this information. If you listeners, if you've got questions about what to do after a brain injury for your children or for yourself, or you've even had a past trauma you don't feel like you've completely recovered from, is it ever really too late, Jason? Are there things that can be done? I know it's difficult for the brain to heal completely, but it does heal. There's a lot of things that it can repair from. Do you think it's ever really too late?
I've seen brain injuries as 15 and 20 years old, where we've literally been able to help people have stimulate neuroplastic changes where they've regained function that they almost better than before.
Yeah, thought that it was never going to come back, right?
We've seen it. And if you read, books by Daniel Coyle, The Talent Code is an amazing one. Dr. Norman Doidge is a medical doctor. He wrote a book called The Brain's Way of Healing.
Right.
Amazing books. You literally, and I don't know, it's really humbling because I sometimes don't even believe that I can help the people that they tell me that, oh yeah, you can help me. So-and-so told me to come in here. You can help me. I know it. I'm like, well, I'm not going to promise. And we just work through the system, work through the steps, get the steady fuel, get dampen inflammation, and then help people learn and practice and be productive and at these specific exercises. And their brains change, even in their 60s, even in their 70s, even in their 80s. So I'm not going to say guaranteed, but if we identify the right regions that need to be stimulated, we can make it happen.
And, I think taking a team approach and looking at this from as many different angles as possible gives people the best chance to maximize maybe they don't get back to 100% function, but I often ask this question to my patients, and you might do the same thing, like, what percentage of improvement would make this worth your while? Like, would you be willing to do what I'm going to ask you to do for a 50% improvement? Oh, absolutely. Yes. 20%. You just give me 20% better. I'll be very, very happy. I'm like, okay, good. And then, quietly, we all just hope for 80 and 90%, 100% improvement, but there's always improvement to be made. As long as we're still breathing, there's things that we can do.
Definitely.
All right. So I'm on record now demanding a book from you on this topic so that we can point people in the right direction and we can get people well educated on this. Will you avow to me right now on record that you're going to, we're going to get a textbook here? Well, it doesn't have to be a textbook. How about a very focused, action-based approach to what people can do to help their brain?
Yes, I just finished working my rough draft at the end of the month. So I'm now working on the editing phase, adding some more, make it more readable. I've sort of made the mistake of putting it at a master's degree level. And so I need to make it a little more digestible for even my wife to take a look at it. So
Yeah, if you can get your wife to read it, that's your benchmark
That would
right
be a
there.
big
No.
challenge.
Well, that's what happened with our book when Tammy and I were trying to write the the one book to end them all on everything about health. It's just, never going to get written. And we just realized, hey, we need to help people with some basic things. Here's the right information, and boom, the Simple 7 lifestyle is there now. So let's get the book on how to have a better brain and how to heal from brain trauma. Thank you so much for your expertise, for your friendship over the years, and especially today for your time. Is there anything else that we didn't cover that you think would be helpful? What's your kind of closing comments or last words here?
Well, I think it's three things. One, make sure you're breathing slow and steady
Mm,
after a brain injury. The oxygen is I can't understand. It's too simple, but it's so simple. Like I've never seen a brain injury patient with chronic symptoms that was breathing well. So
mm,
learn how to breathe. It can be box breathing where you're breathing in for 5, holding for 5, out for 5, or just a relaxed in for 4 and out for 8 type of a
mhm.
pattern. But breathing, like you have to change your breathing if you want your brain to heal. That would be the first one. I mean, that's to sort of get the oxygen and the fuel in the tissues. And the
Well, and
second one
sometimes
is
the injury, sorry to interrupt, but if you got injury affecting the brainstem, which is kind of the innate driver of when to breathe, you have to sometimes get more conscious or intentional about breathing because that little feedback system may not be really at 100%.
yes. So the second thing would be like you can literally prevent a brain injury. Like I have one story of a patient who helped her recover from brain injury, and then she was in a class and she dropped a piece of paper, and the student next to her, but they both went to lean forward and grab that
Mhm.
piece of paper, but instead they both smacked heads. And
Right.
the one who had that previous brain injury was nauseated and had to be in bed for a few days. The other one was totally fine. And when we talked to, what's the difference? Impact, same body
Mhm.
size, same speed
Right.
of impact. What was the difference? Well, the one was she hadn't fully recovered, and the other one was hadn't had a brain injury. And
Mhm.
so if you can sort of prepare your brain chemistry by taking critical things like magnesium. There's
Mhm.
so many people that are magnesium deficient,
Right.
and healthy oils. Literally,
Mhm.
those are my 2 big ones. Take
D
magnesium, fish oil, and
DHA, yep.
vitamin D, and you will literally keep your brain primed to not have a brain injury, even if you do
Right.
have inertial head impact or something. So that's the second part. Just take your nutrition seriously. If you can do that, it saves so many weeks,
Yep.
months, years of suffering. And then the final thing I would say is just stay curious and always be learning, because if you have a passion for improving your brain in any capacity, I like to practice the guitar every day. I study Chinese every day and I exercise every day. So those are things that keep my mind and my body all working. So find something that you love to do and just do it daily. Do the most important things daily that'll help you stay curious and stay learning. So if you can do that, your brain will have a best chance of being healthy and you can avoid some of the pitfalls of brain injury.
Awesome. Well, so I'll just encourage our audience if they've missed episode 17, 18, 19, 24. We've been talking about how to basically build a more resilient brain so that when an inevitable injury happens, you've got a much better, healthier brain going into it, which will help you heal. And then once you've been in that traumatic event, continue doing the things that are beneficial, and as needed, seek the advice of people who are experts in this field, like Dr. Jason Smith. So now I'm going to take 2 seconds and plug an upcoming brain breathwork training that we're doing for those listeners who are local to the Salt Lake City area at the end of the month of April. So April 24th, 25th, and 26th. I believe that's Monday, Tuesday, and Wednesday. In the evening in Bountiful, Utah, we'll be doing a breathwork training on a specific approach or modality of breathwork called sky breathing, one of the most powerful approaches to breathwork. So if you're interested in that, reach out to our office, go to duggarwellness.com, and ask about the breathwork training that's coming up. The price is very reasonable. I think it's under $300, and it's as fundamental as life itself, is to learn how to breathe well. So I'll plug that in right here at the end. But thank you for bringing that up, Jason, because that got my mind thinking about that, and we can get some people to that training. It will benefit them greatly. All right, everybody, that's a wrap on today's episode. Thanks for your time. Have a wonderful day, and remember to go out and do some good in the world today. Thanks.